So today we're going to be talking about blepharoplasty or upper eyelid surgery. Now I don't know if you've noticed, but we have certainly noticed an increased number of young patients, namely in their 20s and 30s, requesting blepharoplasty surgery. Now, although this is fine provided it's in the right patient, we're just going to be talking about some of the cautions that you need to take into consideration when you undergo this surgery. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. Welcome to the channel, and we've talked a little bit about upper eyelid surgery or blepharoplasty already, and hopefully you'll be able to see a link if you want to know a little bit more detail. But why are there an increased number of patients in their 20s and 30s wanting to have blepharoplasties? Now, blepharoplasty is a surgical procedure that is used to remove excess skin in the upper eyelid. Generally or traditionally, this has been reserved for patients who were much older, in their 40s or 50s, as the skin descends and there is excess skin in the upper eyelid and it creeps over the eyelid lash and it gives them a tired look. And another reason why patients may need or would like to have a blepharoplasty is because genetics. Some people are genetically slightly heavier because of their family lineage or their ethnicity, and this is a surgical procedure that's very common to increase or give them that eyelid crease in certain ethnicities. However, nowadays we are seeing an increased number of surgical procedures in their 20s and 30s. Now, why is this happening? Number one, there is this social media trend to have more of an upper eyelid show, and that's why people are more focused, particularly on their face, to have that surgical procedure, and having it under local anaesthetic with the accessibility and the fact that it's under local anaesthetic makes people desire the surgery more. But on top of that, we have seen an increased number of patients having non-surgical treatment, and this is generally Botox and fillers. Botox is a treatment that is used to correct fine lines or improve the fine lines and the deeper lines. There is a general trend of what we call baby Botox, or Botox that's used in young patients to theoretically prevent wrinkles coming on in the future. But what can happen inadvertently is that when you paralyze your muscles, you are lowering your eyebrows and in some cases the outer aspect of the eyelids and the full eyelids, and persistent use of Botox can unmask or worsen upper eyelid heaviness. So those patients that have long-term use of Botox, they may feel that their upper eyelid is seemingly lower than what they'd like it to be. Now, most of the time, if you go to a plastic and reconstructive surgeon, they'll be able to recognize this, and the simplest advice will be to hold back on the Botox and regular massage and moisturizing, and this will help improve the heaviness in the upper eyelid, because what the Botox is doing is paralyzing those muscles and making them relax, and in some cases making them sag, giving a more prominent area underneath the lower eyelids and heaviness in the upper eyelids. So it's really important to go to a surgeon that recognizes this, and they'll be able to guide you, and probably if you just held back on your Botox, that will improve the heaviness in the upper eyelid. It's something to be super cautious about, as there seems to be an increased number of patients having this procedure, and it's not without risks. There's always a risk of infection, bleeding, scarring, and the subtleties and the differences that you get versus the risks of the surgery is something that needs to be weighed up. And particularly if you can improve your upper eyelid show simply by holding back on the Botox, holding back on the fillers, this is likely to be a better long-term safe approach to improving your eyelid show. And it also moisturizing, good hydration can improve this. So this is just a cautious approach to having surgery around your eyes, and making sure that the risks are generally worth the benefit, and making sure that a simple solution to help with improving the upper eyelid heaviness is tested first before going down the very serious solution of surgery in the upper eyelid. I hope this information is useful to you. If you have any questions about upper eyelid show or any form of rejuvenations, do let us know, and I'll see you in the next video. Bye.